Hello and welcome everyone. I'm Phil Naylor and thank you for joining me today. Today is Tea with the Therapist session 9. Again, I'm Phil Naylor. I am a therapist. I have brought my tea with me and I hope that you bring some tea to this as well, or just your relaxed self. So tea is just kind of a metaphor for, you know, being relaxed, enjoying, just pulling up a chair and having a little chat. So, which is the intention of these little sessions here. An opportunity for me to talk to you, and hopefully, maybe you can talk to me by uh, asking some questions or leaving some comments at the end of this. But I'm doing this because it is my outreach, I guess, into the world to help to educate people about mental health and wellness issues and to just kind of bring that whole thing forward to give people skills and insight because there's a lot of this going on out there in the world and there's no systematic kind of instruction or support for people around mental health. We know a lot more about it, physical health, I think, than our mental health nowadays. So, as a therapist, I see that people lack a lot of just basic skills and basic knowledge about how we work. Now, a little proviso is that this is my own particular perspective that I bring from about 20 years of in mental health work and even earlier work in kind of the broader human service work, as well as I guess my own, as well as my formal training, all my personal studies of personal development, mental health, wellness, and a broad range of areas that I kind of synthesize my particular approach. So I don't think you'll find anything I say exactly controversial or contradicting anyone out there. And as a matter of fact, you may hear what I have to say echoed in a lot of ways, but I don't necessarily represent a particular point of view that or formal school of psychotherapy or whatever that's out there. So this is basically my own theory or my own, I guess, theories and and experience that I bring forward to these little sessions, and also just to add the proviso that these sessions aren't psychotherapy; they are just education and information and instructions, and just an attempt to be helpful. So anyway, just pull up a chair, grab your tea, and just join me for a few minutes. Today's topic is trauma, and trauma is it's a big subject, and I think it's got a lot more relevance and impact in mental health than we have thought in the past. Trauma was kind of part of the original theories of psychotherapy back in the Freudian days. Psychoanalysis, they were thought these traumas that happened when we were young had a lot to do with, how we thought later on, and these things got wedged into our unconscious. And that kind of thinking kind of went by the wayside over the years, and we developed more of a cognitive, I guess that's a trend, is more cognitive um, therapy, where we focus more on the here and the now and what's going on with you right now, and let's address what's happening with you right now, which is important. It's not, we can't just dwell in the past, but it's also important to understand the roots of things so that we have a good understanding of where things come from. So I think over the past number of years, we've seen a rise in the trauma coming forward as being important in therapy. We're seeing it linked to all kinds of issues, and I think it's probably even more pervasive than, more behind a lot of mental health issues than maybe what we even thought. But this session kind of follows on what I started to talk about around anxiety, and because when we look at what are the symptoms of trauma, so typical trauma, what do we look at? How would we know somebody has struggling with trauma? So the main kinds of things we look for were anxiety, panic attacks, depression. Going along with that, we would look sometimes at nightmares and bad dreams. We would look at things like addictions and chronic pain. All of those things together are really good indicators that somebody has experienced trauma. Now, we often think of trauma in terms of the big T traumas and the things that people experience that they remember. You know, people that go to war or have some sort of assault or life-threatening situation happen to them, and they come kind of all freaked out after that, and it's obvious, you know, that there's a post-traumatic stress disorder. We've kind of term it when there's these classical symptoms. So when we notice these things that we can directly link, you know, oh, this experience happened then, we've got these sort of symptoms happening afterwards, it's easier to see trauma. But even then, it's not always as simple, because people have these things and they kind of shake it off and say, oh, yeah, and I move on from there. It was hard to cope with at the time, but, you know, and then, but later on they develop the symptoms and they don't link it to this. So somebody might have a car accident, a bad car accident, and then they kind of shake it off, and then 6 months, a year later, they're noticing they're having anxiety and panic attacks, and they have no idea why. And they hadn't linked it to that car accident that they had. And that's why we tend to call it post-traumatic stress disorder, because the symptoms of the trauma happen sometime after. It's a delayed kind of onset. So often the signs of trauma happen after because we brace ourselves, we're kind of in coping mode during the traumatic thing and immediately afterwards. It's when everything settles down and the trauma is gone that our, you know, nervous systems and our mind starts to try to process that stuff, and we start to get these trauma incidences. So, but that's not where the majority of trauma is found in the sense of this more subtle traumas, when we just are looking at anxiety and depression and just so these kind of normal symptoms that people bring forward. So a lot of people come to me and say, well, I have anxiety. And so my first question is, okay, how long have you had anxiety for? And so it could be, you know, it started a year ago. Or a lot of people say, well, I've always been anxious ever since I remember. And I might probe them a little bit. Well, what's the earliest that you can remember being anxious? And they might think of high school and primary school. And that gives me hints. Always, like, when did it start? Gives me hints of when did this thing happen that is giving you anxiety. And so when we trace these sort of long-term anxieties back, where did they come from? Now, nowadays, we tend to see all of these as discrete things. Somebody brings anxiety, we treat anxiety. Somebody brings forward depression, we bring depression. Somebody brings forward panic attacks, we treat that. As if they're just their own thing, unconnected to anything else. But when I see those symptoms, I immediately start doing a history and gathering information. Where and when and how did all this start? And often when it starts at an earlier time, I'm looking at the childhood influences. So a lot of things, issues that people bring to me actually are rooted in early childhood traumas. And so doing a good interview and finding out what happened when you're growing up is important, because those early childhood experiences set things in motion. If we have an issue that, and there are issues when we're a kid, we can experience issues that are experienced as traumatic at that time, because as children we don't have a lot of resources to deal with stuff. We don't have a lot of resources to kind of manage that trauma that happened. Whereas if it happened today to us, we'd have a lot more resources. You know, we've got a lot of experience. We're physically stronger, bigger. You know, we've got all of our critical faculties and all of that's available to us. And so we have a lot more resources to bring to bear on an issue, whereas a child doesn't have a lot. They don't have a lot of coping skills. They kind of go into fight, flight, freeze, and mostly freeze when they go into trauma. So, and what may seem like a small thing, not so traumatic, may be a big thing to a child because of that ability to not have trauma, not have a lot of good coping mechanisms. So those early childhood experiences are very important, and I use a particular tool to quickly gather how significant an impact their childhood issues may have had. And it's called, I don't know if you can see this, but it's called the ACE questionnaire, the Early Childhood Adverse Childhood Experience Questionnaire. And it has a number of questions. I just have people quickly fill this out. So some of the questions are, did a parent or other adult in the child and in the household often swear at you, insult you, put you down, or humiliate you, or act in a way that made you feel that you might be physically hurt? The question, did a parent or adult in the household often push, grab, slap, or throw something at you? Ever hit you so hard that you had marks or were injured? There's a question about, did an adult or person at least 5 years of age or older ever touch, fondle, or have you touch their body in a sexual way, try to, or actually have oral, anal, or vaginal sex with you? And it goes on with a number of things. Were parents separated or divorced? Did you feel like you were loved and cared for in your family? Was anybody a problem drinker or have addictions in your family? Does anybody mentally ill or attempt suicide in your family? Anybody go to prison? Those are sort of the few other questions that I would actually add to that. And I would be looking for was, did anybody experience the death of a parent or sibling or very close family member, immediate family member when they were growing up? Remember, this is all pre-18 years of age. Any significant accidents or serious life-threatening illnesses, including significant periods of hospitalization. I'd look at whether significant bullying. I mean, bullying sounds like kind of a, one of those. It's just one of those things that happen. Bullies, big bad bullies. But for a kid, bullying can be very terrifying. Like, they feel like they're very threatened, they're very scared, they're being assaulted. And if you think about it, as an adult, if you're physically bullied, like some of the bullying that happened maybe when you're a kid, like if you went into work and guys were waiting for you to beat you up every time you went to work, that would be a pretty traumatizing thing to happen right now, right, in today's world. So imagine what it was like when you didn't have the skills to cope with it, or just teasing and all of those sorts of things that can be very traumatic. Significant periods of separation from parents, maybe a foster childhood experience where you're taken into care, or significant life events like scary things like having a big house fire, or your house got hit by a tornado and you're in the midst of that. So all of these are kind of relevant things to think about, because these can all impact us as kids. And when we're kids, we are in the process of formulating who we are. We don't have all, like I said, our faculties and resources. We haven't developed even our personality. We haven't become who we are today. We're in the process of developing that as children. So our brains are developing, our concepts of the worlds are developing, all this information we're sucking in. And so significant experience, adverse experience, become very, very prominent in our development. And then we find a way to kind of deal with that as kids. And those things experiences get rooted kind of deep into our unconscious, and they affect the way we see ourselves, the world, and other people. And so we had talked earlier about when I was talking about anxiety, I gave the example of the bear. If you're walking through the woods and the bushes are rattling, it's the bear. All of your resources get mobilized. You start to, have some adrenaline pumped into you, and your heart races, and you breathe fast and shallow, and all of those resources come online because it's a threat. And if a bear attacks you, that becomes like a trauma. So think of the metaphorical bear. Any experience that we had when we were young that at that time felt like the bear, that was a big and overwhelming and scary and we couldn't handle, becomes like a trauma. And we then, as I pointed out, once we've had a trauma, we become hypervigilant to situations that are remotely reminiscent of the thing that happened. And our brains store that, our subconscious mind stores that bad experiences. Oh my God, that was awful. I couldn't take that thing. I couldn't take anything like that happen again. So then we become hypervigilant. So any little thing that happens later on that has slight reminiscences of when that original trauma took place, it just puts it together. And it just says, oh my God, it's happening again. And that creates that anxiety response. And so, again, we may be scanning our environment for things all the time out of those bad past experiences. And that can create our overall anxieties. Now, this adverse childhood experience questionnaire doesn't guarantee, doesn't mean that you have trauma. Any one of these things could adversely affect you or not. They were maybe struggling at the time. But some people, one or two of these experiences can profoundly affect them, and other people, that doesn't have too much of effect on them. It depends on a lot of other factors. It depends on the bigger context of their life situation, if they've got other supports and loving family members and all this sort of thing. On the other hand, some people have yeses to all of these questions. I've had people literally have said yes to every single one of the questions. And that many things happening to people, and especially if they're chronically involved in an unsafe situation, can have profound effects on people. And so that's, it's a very significant thing. So if people have a lot of yeses, we really are suspecting childhood trauma. And that doesn't go away. Once we have the traumatic experience, it is always stuck in our nervous system. And we always are on some level aware and prepared to respond to those. And when we come into adulthood, we often carry a traumatic, we can actually suffer from post-traumatic stress disorder as a result of what happened in our childhood. So it's very important to look, when you're looking at your own sources of anxiety and depression, is to look, you can get this off the internet, you can just Google ACE questionnaire, Adverse Childhood Experiences Questionnaire. Print it off, fill it out yourself. See how many yeses you come up with. Have some reflection about how was your childhood and how did you think it impacted, how difficult was it. And all of these can lead to potentially childhood trauma. And people will say, oh, I had a tough childhood, but that was then. And it doesn't work like that. We don't shake it off. It gets embedded in our subconscious and our nervous system. And we will carry anxiety and panic attacks into our adult years. And it will stay there unless we do something about it. And often, what do people do about it? Addictions. That's why addictions is so linked to trauma, is because they didn't develop the tools to be able to regulate their nervous systems and to be able to manage the trauma at the time. And so drugs and alcohol are one way to do that, right? It's a regulating strategy. And so that's why people who have trauma can easily get into drug addictions, because they are attempting to calm and soothe their nervous systems. So some of the strategies, how we deal with that, I've kind of already covered in some senses, but I will probably cover more of that, because we have to essentially calm and soothe the nervous system is one of the major strategies of working with trauma. We have to sort of get our systems feeling more safe, get them to be less reactive, get them to start to reinterpret situations that they are seeing as potentially threatening as non-threatening. And so that's where the therapeutic work comes in. And but knowing the starting point, knowing where this stuff came from, really helps people understand, why do they have these things. They don't understand why they have anxiety and depression. When they kind of see, oh, that might be related to what is going on now, and as we start to join the dots, they start to see, oh yeah, it makes sense. And then it's a lot easier to kind of have that framework to then do the work that we need to do to change those patterns that we get stuck in. So I'm going to wrap it up for now about that. I'll be talking more about trauma. I consider myself kind of a trauma therapist, and I think a lot of mental health is trauma informed. So we have the big T traumas, like I say, these horrible things that happen. We also have little T traumas. They're more minor things that happen, but they get stuck there. As a little kid, a little thing that can happen, it just kind of freaked you out at that time. It's something that maybe wouldn't freak out an adult or anything, and that gets stuck in there as a little trauma. And these little traumas, emerge at unusual times when we're adults, and so a lot of what we experience is trauma. So chronic pain, I should mention too, is that anybody who's chronic pain should be looking at their past traumatic experiences, especially early traumatic experience, especially people that have things like fibromyalgia, very much linked to trauma. So please check this out. Think about if you're experiencing anxiety, depression, panic attacks, and any of these other things. Start looking at where did this come from. And it might be, and I'm not saying it is, I always say kind of the 80-20 rule. Not all anxiety, all depression is based in trauma, but a good chunk of it is, I'd say probably about 80% of the anxiety, depression that I see has its roots in trauma, particularly childhood trauma. So that's something to think about. So yeah, I will be talking further about these issues, further about trauma as we go, how it's a foundational kind of fundamental guide to our mental health. Trauma, I think, underlies a lot of mental health issues, far more than we have maybe thought in the past. Okay, well, thank you for joining me. I hope you had a chance to have a sip of tea, and maybe you can sit and ponder and have a tea to think about some of this afterwards. But please leave a comment, a message if you would like. If you know of anybody else that could benefit from watching this video or the series of videos, give it a forward, give it a like, whatever. And thank you for joining me, and we'll see you again next week. Thanks so much. Bye-bye.